Welcome to the 1% Doctor Podcast. What separates the good from the great, the standard from the extraordinary? It's mindset, it's execution, and it's the relentless pursuit of growth. I'm Adam Lamb. I'm your host. Welcome to the show. Welcome back to the 1% Doctor Podcast. I'm your host, Adam Lamb. Today, we have a very special guest, a very good friend of mine, an amazing physician. I would say he is one of the OGs of hormone therapy. And here's part of it. Why is Dr. Birken, Dr. Randall Birken, my guest today, is not only has he been practicing medicine for a long time, and he's been in the hormone optimization space since most people didn't even know what it was, but he still lives it and does it every day. So, I mean, it's 75 years old, been taking care of people forever. Taking care of himself really well, which is one of the things that I just really look up to him for at 75, skiing and golfing and running business and still helping people, still being a leader in medicine and training people, teaching, like just an amazing guy. So we're super honored to have him on the show today. Dr. Birken, my friend. Glad to have
you. Thank you so much. And privileged to be here. And I commend what you're doing with your 1% Doctor in trying to enlighten your audience about different health paths for well-being, but also making changes in life, particularly other physicians who are trained conventionally but are looking for other avenues to expand their expertise.
Yeah, so share a little bit about like when you got into medicine, why you got into medicine, and then, and then let's get into like when you had that pivot from kind of the traditional training path to when you said, man, there's got to be there's something different here. And then you kind of did a pivot in your career. Let's talk about
Right. Yeah, I graduated medical school in 1976 and started my residency program in obstetrics and gynecology at Baylor College of Medicine. It was very tough training, but excellent training, a lot of clinical experience. I was chief resident in 1979. When I finally finished my residency program, I was offered a faculty position at Baylor, and I still serve as a clinical assistant professor. But I opened up my private practice in a part of Houston that was really growing. In my first 10 years, I actually did general OB-GYN. So I actually delivered babies in addition to doing gynecologic surgery, and I was really busy delivering anywhere from 30 to 35 babies per month. But my penchant was for surgery, so I actually did additional urogynecology training in 1989, stopped delivering babies, and just devoted my practice to gynecologic surgery, particularly pelvic floor surgery, reconstructive surgery. And that really changed the entire dynamics of my practice, because now the predominant patients were women who were either menopausal or perimenopausal. And for that reason, I used to prescribe a lot of hormones. Mm-hmm. Unfortunately, I prescribe commercially made synthetic hormones. Why? Because my medical society say don't use the compounded or plant-based hormones. They're not regulated. You have to stick to the commercially made synthetic hormones. I've always been a rule follower, Adam. So yes, that's what I would prescribe. My wife became menopausal late 99, early 2000, started her on these synthetic hormones. But I really had worries. I mean, I used to see, on the average, believe it or not, Adam, 1 case of breast cancer per month. Wow. And I told my wife, look, I think it's these synthetic hormones. Sadly, the drug companies tell you, no, they're safe, you have nothing to worry about. But then studies started to emerge that showed a potential link with the synthetic hormones, and not only a higher risk for breast cancer, but a higher risk for heart disease. And that's when I told my wife, look, I know I'm a rule follower. I know this is what my medical societies are telling me to do, but I really have to study something different. And I had heard about plant-based hormones, but I really didn't know much about it. We're not taught that in conventional medicine. So I decided to take some courses. And I actually, fortunately, aligned with a doctor by the name of Neil Rouzier, who was one of the pioneers in teaching compounded hormones. Matter of fact, this goes way back to 2000 when I took his first course. We didn't even have laptops then. He had an overhead projector where he was putting the slides on there. And there were about 17 or 18 doctors in the group. Anyway, I came away from that course. I called my wife up on the way home and I said, "You're not going to believe what I've learned. I have
Wow.
never been taught these concepts. What
And I
I'm
think right there,
giving."
pause and think of how many physicians just don't take the time to just go take a course, man. Just go learn whether it's functional medicine and some non-traditional stuff, like because it could be a gateway for you to create another revenue model, an opportunity to help more people. Like there's just the there's the tangible stuff, but just to expand your perspective of what else exists in medicine and healthcare that you weren't trained in that kind of siloed path of education. And so,
Exactly.
kudos to you for doing it. And I know you're still you're still taking courses, you're still learning stuff at 75 years old. But so like that woke you up and you called Liz, your wife, that's your wife. And what happened from there?
I said, "Look, you're not going to take these synthetic hormones anymore. And I'm taking all my patients off of it. We're going to look at labs. We're going to individualize their hormone protocol. And I'm going to give you something that's going to be more effective and safer." And in fact, that's what I did with her. And that's what I did with my patients. And women would come back and see me 5 or 6 weeks later and go, "Dr. Birken, I am a new person. I have
Wow.
energy. I'm sleeping at night. I have mental clarity. I have drive and motivation. I'm losing weight. My mood is better." Adam, we got busier and busier. More and more women were requesting these hormones. And I was quite delighted to begin them on it, knowing how safe it was and how effective. What I didn't predict was about 8 or 9 months later, I'm now getting phone calls from the husbands or male partners of my female patients saying, "Hey, my
Yeah.
wife, my partner's doing really well on your hormone protocol. Can you treat me? I'd like
Right.
to feel as good as she is." And I had to make the decision as a gynecologist, so I treat men. I told my wife, "I just don't think it's fair not to treat the male partners." So as a courtesy, I started treating them. They did well. They started referring more of their buddies to me. And Adam, 3 years later, my practice goes from all women, pretty much 50-50 men and women.
Yeah.
Quite a change for me.
And
But
here's the cool part is all referral, right? You just decided to take care of, because, it's funny when I moved here to the Woodlands and I've been in the hormone space for at that point, almost 10 years. And, your name was the name I heard around, this Dr. Birken guy, this Dr. Who's this Dr. Birken guy? And you grew your practice huge, 100% referral, became like a local, name brand in the community, and have stayed busy helping people with a bit of a different path than the traditional medicine for a couple decades, right? It's amazing. And we'll dive into, kind of where you're at today and what you've built. But, how did you continue to sustain the growth of the practice and do some of that stuff?
yeah, it was really all word of mouth. People would do well, and when they would do well, they would tell their friends, they would tell their family members. And Adam, I became a physician to help people. So it's very gratifying to have people do well, but not only do well. Study after study shows that when your metabolic and reproductive hormones are optimized, there is a reduction for age-related diseases. There's a lower risk for heart disease, a lower risk for dementia, and a lower risk for breast cancer in women, and we think even a lower risk for prostate cancer in men.
For sure.
And again, I get great gratification getting patients off of medication. I mean, I get people off of antidepressants, anxiolytic medication, attention deficit drugs. People are able to lose so much weight, they're able to get off their blood pressure medicine. Let me give myself as an example, okay? So I live a healthy lifestyle. I eat very clean. I work out every day. I take my supplements.
Yeah.
But
You
when
look
I
better than
turned
40-year-old men. That's the part, and that's the thing that, you lead it, right? It's one thing to talk about it. It's one thing to prescribe it, but like you're somebody, all you have to do is walk in the door and I'm like, sign me up for whatever the Dr. Burke plan is. Cause if I can live life the way you are at 75, I'm in, and
well,
I
lifestyle changes are really important, but the hormones are too. So yes, when I turned 50, I didn't feel well. I kept thinking, what is wrong with me? I was tired. I wasn't sleeping well. I had a lot of mental fog. Then my body started changing. I started losing muscle mass. I started gaining belly fat. I had a lot of aches and pains. And I thought, look, I'm going to look at my numbers. I want to see what's going on with my labs. And when I checked them, I found several deficiencies. My vitamin D was low. One of my adrenal hormones was off. My thyroid was not optimal, and my testosterone levels were low. So I put myself on a protocol, and I kid you not, Adam, within a few weeks, I'm a new person.
Yep.
My energy, my mental clarity, my sleep improved, my drive and motivation. I would go to the gym. I really didn't want to. I would go, but now I couldn't wait to work out.
Mhm.
Aches and pains went away.
And
3
I think that's
months later, yeah, 3 months later, my body fat went from 28% to 12%. My waist size dropped from 36 inches to 31 inches. I even used to take a statin drug. My cholesterol dropped 100 points in 3 months, and I was able to get off of it. So yes, I'm
well,
75. My wife will be 75 at the end of the year. We're never going to get off these hormones. Never.
yeah, one of the key things I think that people don't realize is, sometimes if your body, like you said, if it's metabolically not optimized and your other, your reproductive hormones aren't optimized and you're putting in the effort, it's like even if you're giving 100%, but you're only getting 50 or 30, 20% of the outcome, it's hard to stay motivated, right? So it's like, it's painful physically, like literally to go to the gym or mentally to go to the gym to do this stuff. And then like when your hormones are optimized, you're like, that's not hard anymore. Wow, that's easy. I feel good about doing that. And then that's the transition. And it's amazing because we can look at this and say like, there's people that don't want to work out. And there's people like you and I that I have to go to the gym 4 or 5 days a week to feel good. Right. And so when my body is in the right place to do what it's supposed to do and feel good and like you say, have better sleep and all those kind of things, I'm more motivated to do those things. And so it's like when your body actually is cooperating with your effort, you're more likely to make the right choices and the right decisions from a lifestyle standpoint versus if your body's not, you're like, man, I'm doing all the right stuff, but I'm tired. I'm still getting fat. I don't want to go to the gym. Like I'm kind of depressed. Like, my libido doesn't even exist and my wife's good looking, but I don't know what's wrong with me. And so,
Right.
that stuff happens. And then when you get the hormones optimized, everything just gets easier. And like you said, I love it.
Yeah.
You're 75 because some people, they're like, well, hey, do I have to be on testosterone for life? No. But if you want to feel like this after a certain age, you're going to have to be. Why wouldn't you want to? Right. I plan on being on testosterone. I'm 45. I'm on it and I'll do it for the rest of my life. And I love that at 75, you and your wife Liz, almost 75, like you're going to be on it forever. Why wouldn't you? Right.
Why
And
wouldn't you? Is exactly correct. And as an example, I have a colleague, he practices in New Mexico. He told me he has a patient who still does the hormone. She's 100 years old,
that's awesome.
and he
The
has
oldest
a,
we ever, yeah, the oldest we ever had in ours was 99. He was 2 weeks from his 100th birthday before he passed away. But at 95, he was on his deathbed, and his primary doctor was also a client of ours that got him on board. And the guy lived; he was a mega millionaire, and I think his kids were mad because he lived another 5 years. And he lived a good life. But he just, yeah, at 99, he passed away, but he lived a great life because of what we did. And so, I love that 100. I
yeah.
hope I'm on
And I
testosterone.
tell patients, we're not trying to, I mean, we'd like you to live as long as you can. It's your quality of life.
Yeah, the
That's what
health
makes the
span.
difference.
Yeah, health span versus lifespan, right?
Exactly.
Think of most people your age at 75, they're like sitting in a chair all day and you're still out skiing, you're still out golfing, you're still doing all these things. It's amazing, right? And so the fact that you're still doing all that stuff, but it's decisions you made years ago with your health and your hormones that allow you to actually do that.
Very much so. I mean, I've always lived a healthy life, but when I turned 50, it was a struggle. And we actually start losing our hormones after 35. So it's not like you have to be a really older individual. I get younger people that come in. I even have today some college students with
Yeah.
low testosterone levels.
Well,
And we're
think of
not sure
think
why.
of the food, think of the environmental stuff, the stuff that
Exactly.
you definitely didn't have as much of that I had less of. But like, I mean, there's kids today and we've seen stuff where, we don't think they're actually hitting full puberty, right? So like, let's say that we'll just use an example for full puberty, you hit a 900 testosterone and then, at maybe 25 or 30, you start trickling down a little bit. What we're seeing is a lot of these young men, cause they're coming in their early 20s and they're at a 300, 400 testosterone already
Hmm.
that's like at 50. And part of that is I think that so many of the environmental things, whether it's just the food that we're eating, which we know is poison in this country, the lifestyle stuff, the screen times, all of these things that are endocrine disruptors that are leading to destroying our hormones at an early age. And because it was like, we would never look at somebody under 30 when I first started this, but now we're seeing there's a ton of guys, and there's opportunities like, you don't have to necessarily go on testosterone. There's ways to optimize their natural, boost that stuff to try to help kickstart them in a better trajectory. What are you seeing in that? I think that's a very interesting topic.
It is really interesting. And how it happened is that I have husband and wives who have come to me, or it's patients, and they say, look, my son is in college and he's really struggling. He's not doing well academically. Socially, he's not doing well. He's gained a lot of weight. And I go, well, let me look at his labs. And sure enough, usually we are going to see low testosterone levels. We optimize that by using a medication that actually stimulates more of their own natural testosterone at that age. And all of a sudden, 6 months later, they're calling me saying, hey, my son he's an A student now.
Right.
He's got a girlfriend. He's lost 40 pounds. He's happy. And it really had to do with that low testosterone. But the question is, why do they have low testosterone? And I think you really hit the essential points there, Adam. It's something environmental. Food, I don't know what exactly it is.
I mean, it could be alcohol, marijuana. If you're smoking weed every day and eating pizza and like drinking beer every night, you're probably going to have low testosterone anyway. But if you're not doing those things, there can be some environmental stuff of just food that you choose to eat, and some of the stuff, the water or whatever. There's just so many things in our environment now that are unhealthy.
Yeah. And on that same note, I talk about males with low testosterone. Young women, we look for a condition called insulin resistance. And I think doctors need to look for this because it is the most common premenopausal endocrine disease. 10% of women premenopausally have insulin resistance. And insulin resistance is a condition where your pancreas is producing too much insulin. There's a problem with the receptors in our tissues, so that there's a feedback mechanism telling the pancreas to produce more insulin. When your insulin level is high, it's dangerous. These women don't do well. They gain weight.
Yep.
They can have acne. They're at a higher risk
shuts your natural growth hormone level down too, which is
shuts that down because it competes with that.
Hair and skin and nails and burning fat and retaining muscle mass and all those things too.
Yeah. My 24-year-old oldest granddaughter who's married, I treat her for that condition. There's infertility issues, higher risk for breast cancer, uterine cancer. Do you know, Adam, I was never taught about it in traditional medicine. I had to learn it on my own.
Yeah, for sure. And that's the part when we talked about earlier about taking courses and learning stuff, especially from someone like you. I know you teach a lot of stuff too today. Like there's just another way to help people, and people will pay for it and people get great results and they'll refer a ton of, like you're living proof of, because you got into this 25 years ago and like a cash pay hormone optimization model was like, nobody heard of that. No one was doing that. And you've built a really successful practice and business over the years, and you've helped thousands and thousands of people get their life back, right? So it's versus just giving people a Band-Aid or a pill to mask a problem, right? And it's awesome.
Yeah, and I'm really glad you touched upon that, Adam, because when I started doing this, my wife, Liz, has had the foresight to say, look, if you're going to do this, do it out of network. I go, well, why would you do that? She said, well, this way you can spend more time with patients, because before I'd have to spend 5 or 10 minutes per patient.
Right.
So when we went to fee for service only, I can now spend 45 minutes with a new patient, 30 minutes for follow-up. And that allowed me to really talk to the patient, go over the labs, find out what their goals are, extrapolate that to a protocol that would be successful. I was a little bit worried about doing it, but patients were willing to pay for that value because they weren't getting it with their traditional medicine. To spend 45 minutes with a doctor going everything over about the labs and what we're going to do and options and way to change your lifestyle is so valuable, and people are willing to pay for it. And it opened up a whole new concept for me economically. It did.
And that time together allows you to ask, and here's the deal for those listeners. If your doctor's not asking about your sleep They're not asking about your food intake. They're not asking about your movement. That's probably not a good doctor, right? But when you have that time with those patients, you get to address all of those things. And at the end of the day, if I have 5 minutes with a doctor, I'm thinking of like that one need that I might have versus 45 minutes of a conversation that's not intense. And it goes like, oh yeah, by the way, such and such happens. And that could be an eye-opening reason of
Hmm.
this is causing that thing. So versus us just giving you a pill or something to check that box, we now discover what a root cause situation might be through conversation. And you're right, people will pay for it. I'm a big believer, like you should be prepared to spend 10% of your income on your health, whether that's part of your gym membership, seeing a physician like you that can help take care of it. Because look, when you're sick and you're not well, who cares about anything else? Right. When I think of that, and that's something that a lot of I coach doctors and other people, and reminding them that you are the greatest asset you have, that your health is the most important thing. Because if you don't have your health, if you're on your deathbed and you can't function, you can't produce, you can't be there for the kids' games, or you're not, those guys I talk to, they're like, oh yeah, my kids are the most important thing. And I'm like, your health says you're lying to me, because your daughter needs you to walk them down the aisle. Your daughter needs, don't you want to meet the man? And like, see guys going to tears and have a change in their life because you can say something like that, but at the end of the day, you're blessed to you got kids, you got grandkids, like you get to be involved in all their lives and do all these cool things with them, and like that's really what life's all about. But
Hmm.
if you don't take care of your health, it's not about, a lot of times we talk about hormones. It's not about being a bodybuilder or being fit and ripped and bench pressing 200 pounds at the gym. That doesn't matter. If that's what you want, that's great. But it's just about, like you said, that health span, right? The quality of life for the amount of time that you're here should be the top priority, because it's going to allow you to do all the things that your heart desires to go do and live a really fruitful life. And
Hmm.
why wouldn't you want to invest in that?
Right. Right. And that's why I published a book on hormones called The Bioidentical Way, because again, I wanted to become a journalist. I ended up becoming a physician, so I enjoy writing. And
I got it right here. It's here on my shelf right behind me.
so I have,
Was it by design? It is. It was right here behind me.
I have different clinical vignettes in there so patients can read it. And instead of writing a book that was more like a textbook about the science of hormone optimization, I put it in a storyline so people could relate to it. And when I'm done with a new patient, I email them tons of information
Hmm.
about thyroid. There's a really good article written by a breast cancer surgeon, Dr. Rebecca Glazer out of Ohio. She's done all these studies on testosterone in women. And the sad thing is, most people think testosterone is the most important reproductive hormone in men. Well, it's the most important reproductive hormone in women.
Yeah.
And sometimes women think, well, if I take testosterone, I'm going to grow hair, I'm going to get aggressive. And it's just the opposite. It's mood enhancing.
Yeah.
It protects the breast. It protects the bones better than
Yeah.
anything. I've had patients come to me with osteoporosis and they're on certain drugs to try to improve their bone health. I get them on their reproductive hormones. 2 or 3 years later, they have a normal bone mineral density
Yeah.
test.
They've reversed it. Yeah.
We reverse it.
I mean, it absolutely. And I think women, especially that perimenopausal, postmenopausal, like testosterone is that drive hormone, right? That's the hormone that's builds you and carries you. And when you're kind of done after the baby making years, you still need some estrogen. Men do too. We still need estrogen, but we don't need the amount required because that time of our life has passed, but we still always need that testosterone to
Always need it.
continue to keep our body strong, resilient through wanting to have an active, healthy life.
And the reduction of age-related diseases. I mean, on and on and on. Lower risk heart disease, breast cancer. And again, there are studies show that men who develop prostate cancer probably have low testosterone.
Well, yeah, and that's, even conversational. You could say, hey, the guys with prostate issues, are they young or old? They're older. Do older guys have low testosterone hearts, right? And so we've seen it. Yeah, testosterone is prostate protectant. We've seen plenty of studies that do it. And here's something that you and I know, it's just recently changed, was, there was this black box warning on testosterone for years that it was caused cardiovascular disease, when actually the studies are the total opposite, that it prevents or either protects at least a lot of cardiovascular disease. And I even had on the podcast recently, Dr. Wade Fisher, who's been a client. We've worked together for years, great friend of mine, cardiovascular surgeon. I put him in kind of the Dr. Birken category, 68 years old, still works out, 4 days a week. He's a big believer in testosterone. And he's also believed, even though in his community, testosterone was considered bad, he knew it wasn't bad. It's actually cardiovascular protectant. And they finally this year removed the black
Right.
box warning off of testosterone because it does improve cardiovascular health.
It most certainly does. And not only that, it also has a glycometabolic regulation. So I have a patient who's an engineer. When he comes in to see me every 6 months, he brings in graphs
Yeah.
and he's a diabetic. So he shows me his blood sugars, his hemoglobin A1C, and as his testosterone levels start to drop, those numbers go up. So he
Mhm.
has much better diabetic control when he has a good testosterone level. So it does have an effect on glucose metabolism as well.
Yeah, 100%. Yeah, that's interesting. I want to talk a little bit about, with your practice, you know, talk a little bit about what you do and how you spend time also teaching people. I mean, you've won awards and some of those things. Like, share. Let's brag a little bit for you, Dr. Birkin, because I think you're such a wonderful, like I said, you're a great friend of mine. I've always looked up to you and always will. But let's share some of the, because I know like BioT, you've done a lot with the pellets, but you're not like pellet only. Kind of whatever fits best for the patient's goals and needs. Let's talk a little bit about the educational piece where you've helped train, probably you lost count of how many doctors, and talk about that a little.
Yeah, I really enjoy not only enlightening patients, but enlightening physicians and clinicians, because they could be mid-level clinicians. I don't mind that at all. Teaching them these concepts. And they'll either give a lecture or they'll shadow me in my office for a day. And that's where it doesn't end, because you have to continue to learn and to teach. So I get texts and emails all day from physicians who have trained with me with questions.
Mhm.
And I have no problem giving back. When I first started doing this, Dr. Neil Rouzier was kind enough to answer my calls whenever I had questions because, I had to learn how to do this. So I really like giving back to physicians, having them get really well trained in this, feel confident about their clinical decisions and being available. So yes, I give lectures, people shadow me, but I think the continuum is where they have access to me when they have clinical questions. Like when we're done here today, I'm up in Colorado right now. I practice up here as well. And there's a doctor here who I taught her how to do these hormones about 8 years ago. And she already texted me and said, I have a couple of clinical questions. I said, when I'm done with this podcast, I'll give you a call.
Yeah.
So I love doing that because I really feel giving back to what I was given as a gift means a lot to me. And I really feel a responsibility for that.
Yeah, that's awesome. And like I said, I know you as a man, and like you're just a wonderful man. You care about people. And here's the thing that I think: if you would have continued on your same trajectory of just traditional gynecology, you wouldn't be the guy you are today.
Not at all.
You probably wouldn't be as happy. You probably wouldn't be as excited to serve. You probably wouldn't have the, same, great connection. Like even you and your wife, like you guys are you're an awesome example of like married couple doing cool stuff, fun stuff. I like hanging out with you guys. Had you not got into the hormone space, even for yourself personally, like, I mean, you still ski regularly, you still golf, you
Still
travel.
ski.
Yeah, you got your
Oh,
Colorado place, your Texas place, you're like, the lifestyle piece. And I think of like, for me is the part of, doesn't everybody want this? Right. And it's not like terribly expensive. Imagine at minimum, maybe it's a couple grand a year, like $2,000-3,000 a year that you might spend to like take care of your health. Maybe it's a little bit more
yeah.
depending on what.
No, I don't think any more than that. It's worth it. It's not exorbitant at all.
And I think people have these fears, and obviously you and I are detached from that a bit because we live it and we believe it. And, I'm 45. I've been on testosterone I had low, when I was young, they don't know if it was from either head injury. I was a big time snowboarder, BMX racer, whether I had like testicular injury or, brain injury or something like that. But I had like a 200 testosterone in my early
Yeah.
20s, right? I didn't know
Wow.
what it was. And it was super hard for me to find somebody, this is back early 2000s to treat me. No doctor wanted to touch me. They all thought I wanted steroids or something because I did like to work out. Mentally, I was just driven, right? And I still am. You know me. I'm 100 miles an hour, and that's the speed I like to travel. But my body wasn't cooperating. I was depressed, which I think led to me getting into alcohol and struggling with alcohol issues. And then eventually around 25-ish, I had to get on testosterone, right? And I'd been on now for 20 years, and I still, I would never go back, and I still am responsible. I just had my blood work done yesterday, but I get my blood work done quarterly. I go to the cardiologist every 5 years, just just being responsible. What my wife and I on our list this year is we both are going to get colonoscopies, and we're about halfway through the year, and neither one of us have. But we hold each other accountable. But that's the part, right? Like when you're just engaged with your health. And I love how you mentioned like you brought the women in, and then the husbands wanted to come, and that's a great thing too. When both spouses or hormones are optimized, because here's the deal: if whether we saw my focus was always on the male population, but then we ended up being about 60-40 men to women because they want to bring the wives on board. So the wife's like, hey,
Hmm.
why are you feeling so good? Well, you're going to the gym all the time. You used to be kind of chubby, and now you're looking jacked better than you did when I met you. And then they want a piece of that. And it's like, marriages get restored, like
Yeah.
I talk to these couples in their 50s, and they're like kids again. They're chasing each other around the house. And like, why wouldn't you want that? Right. Like,
Right.
and if it's just your hormones that are in the way, because, your hormones can be blocking your ability to experience that with a bit more ease, right? Like I call it white knuckling it. Like you can like really white knuckle yourself to the gym and white knuckle yourself on a diet, white knuckle, whatever, but it's not fun. It's exhausting to have to do that,
Hmm.
realizing that if you optimize your hormones, if they're not optimal, it's not, testosterone's not the answer for everything. But like if your hormones are optimal, it's just easier, and like when I like to eat, I eat a lot of food, but I stay in pretty good shape. And someone's like, man, what's your secret? I'm like, my hormones are optimized. My metabolic, my hormones are everything's optimized. So I can have ice cream a couple days a week. My cholesterol came back a little high in the LDL, and I think I got to pump the brakes on the ice cream a little bit. But hey, then you keep checking the diagnostics. You can do some course correcting, but it's important
Exactly.
to, when you have the diagnostics, you feel great. It's easy to pivot and just to kind of live life a little bit more fruitful. Anything that you would like, what would you, if last message maybe for the audience, whether it's physicians listening and they're just on the fence of making the move, which is crazy to me today in 2025. Like if you're a physician and you're interested in really helping people, you should be wanting to learn about hormones and actively trying to help people do it. Or patients or, people that are listening today that are still on the fence and they haven't really got it done, or they don't know how to get it done. Like what advice would you maybe share for both those parties?
Yeah, I think the most important thing is to find a physician who is trained in hormone optimization because, and I'm not trying to malign primary care doctors, but a lot of them have not been trained and they don't want to give hormones and they don't really want to look at it. So you have to find someone who's going to do it. I would recommend physicians training with Dr. Neil Rouzier. He still gives his courses. It's called World Link Health, and his courses are fantastic. He goes through all the literature supporting the safety and efficacy of these hormones. And for patients out there who are finding things to be a bit of a struggle, maybe their energy, maybe their drive and motivation, maybe libido has dropped or there's difficulty losing weight, go to someone and get a panel done and see where it is, but find someone who really understands how to interpret this. One of the biggest problems is that when people look at their labs, the labs list what's called a reference range, and people think that's a normal range, and it's not. A reference range means 95% of all patients of all ages fall between those numbers. We want to get hormone levels back to what it was when you were in your 20s. That's when they're usually peaking. So if you go to a physician, they go, well, you're in the normal range and your testosterone's 375 for a male, you need to be up around 900 to 1100. So you're not optimal.
I always use the analogy for people. When you look at the testosterone range, it's crazy because it can be, let's say 300 to 1,000. And I said, hey, if you had the opportunity for me to pay you 30 grand a year or 100 grand a year, which one would you pick? Well, I picked 100 grand a year. Okay. The same mentality goes into the
Yeah,
testosterone. Like I want to be at the higher end of that range because it's better. And it's crazy because it's like the biggest range of any biomarker you can look at, which just,
it is. Yeah,
and
it
the other
is.
part too is when I ask well, like, hey, this is based on your average American's lifestyle. Would you consider yourself an average American? No, I go to the gym every day. I like to have a great connection with my wife. Own a business, or I'm actively growing my things like that in my life. Like you can't operate on on that level of that. If that's not what you connect with, that isn't where your hormones should be, right? They should be optimal if you're trying to live an optimal life.
Exactly. And again, to answer your question, find a physician who does specialize in this, who is trained in it. And it's okay. They could be a primary care doctor or an internist or a gynecologist or urologist, but they have to have been trained in how to look at these levels, how to optimize them, and give you options, because there are many options to do this. There are creams, there are shots, there are oral preparations, there are pellets. We do a lot of pellet therapy, but it's not the only type to do it. So you have to individualize it. Patients are very funny that they have specific concerns. Some people like pellets. Other people say, I don't want that in me. Other people like to give shots. Others don't. So there's creams, there's oral. But whatever it is, come up with a protocol that meets your lifestyle
Yeah.
and your desires, and get those levels optimized. And
Yeah,
Adam,
like a 30-year-old male who's still planning family, like you may have a different way to, you want the physician to look at that differently than maybe a 50-year-old male who's like, that ship sailed, as far as continue sperm production, continue,
exactly.
but all that stuff can be reversed. And I think people think like, I mean, I had a 48-year-old doctor who was a friend of mine who got divorced at 40, didn't plan on getting married again or having any more kids. He already had a couple. And actually just had a baby 2 days ago. So there's the spoiler, but then he got remarried to a younger woman. He's 48, she's 35. She wanted to have a baby. And he's like, man, my sperm count's in the tank. You know, uh-oh. Right. And so, but our team put him on a protocol, and he took his sperm count from 500,000 to 40 million in
Wow.
6 weeks. They were pregnant, having a baby. And this guy had been on testosterone for 10 years straight without, never thinking of that. And he's 48 years old, right? So like, there's people have these fears of like, well, what's if I can't get pregnant? Like all that stuff can be addressed, but you just have to be responsible. And there's plenty of people that have fertility issues that had nothing to do with ever touching hormones. And I think hormones can actually improve those levels in people. And even, we touched on women, but there's something I want to ask about that is, oftentimes too, women don't realize, even if you're in your late 20s or you have children, can totally jack up your hormones on a different trajectory that can be corrected, after pregnancy and nursing and stuff like that. It's just something people need to dive into and explore for themselves, because
Right.
there's a better opportunity.
And Adam, I'd like to offer physicians who are listening, if they have questions and want to ask me about how to get into this, I'm happy to give them that information. And if patients are really interested in this, I think reading my book would be very enlightening. And I'm not promoting it. It's just there to teach patients how to look at this and why I got into it.
Yeah,
And what
I
we can do to
appreciate
help
that.
you.
We'll put all that in the show notes. And yeah, you're not you've reached a point in your life, you've done really well. And I love, because your heart is just to help. You're not trying to make money, or like you're not, you just love to help people. And that's why I think you don't even need to see people anymore, but you still see patients, you still help doctors because you love it. Right. And there's that part of your personality. And again, I still think it has a lot to do with having optimal hormones, is having the energy, having the drive, being excited every day when you wake
Right.
up to like just
Right.
live life. And
Right.
if you're not feeling that way, there's a very good chance that your hormones are off, and that you should be looking at them and getting them checked, so you can live the Dr. Birken lifestyle, getting into the late 70s and still killing it every day. Like I think it's awesome and inspiring.
Well,
So
I'm very passionate about it, because not only do I live it, but when I can change a patient's life, that is such great gratification. Again, that's why I became a doctor, to help people and even get them off of medications. I love getting patients off of drugs.
Mhm.
But really, that's the gratification of it. And that's why I became a physician, to help people.
I love that. That's amazing. So I'm so grateful to obviously have you here on the podcast, but to know you as a friend, a mentor, someone I've always looked up to and just had a great relationship with and worked with for a long time. So thank you for all of that. I look forward to the continued relationship. Thank you again for being on the 1% Doctor podcast. I'm your host, Adam Lamb, with a very special guest Dr. Randall Birken. We'll put all Dr. Birken's information in the show notes. When the episode comes out, you'll have all that information to reach out to him, check out his book, and all the resources that he offers. Thank you, Dr. Birken, for being here today. We love you. Glad
Thank
you're
you,
here.
Adam. And thank you for what you do. I appreciate it too.
Yeah, it's my pleasure. And that's a part. I have a heart for people to get better health, and I have a heart for physicians that are out there offering that. And I think an opportunity to highlight folks like yourself that are doing it is really important.
Thank you, sir.
Thank you. Thank you, listeners. Please like, subscribe, and share this episode. My name's Adam Lamb. This is the 1% Doctor Podcast. We'll see you next episode. Thanks so much for tuning in to this episode of the 1% Doctor. Please be sure to subscribe to the show where you're able to consume more podcasts, get more value, and learn more about doctors potentially just like you. Please tell a friend, review the show, and we'll see you in the next episode.